Warning: the following program contains content and language that may be inappropriate for younger viewers. There are graphic depictions and portrayals of addiction that will be shown. Parental discretion is advised. Hello, I'm Steve Kendall, your host of WBGU-TV's new series, Addiction, Heroin, and Pills. In this part of our series, we'll look at the social and economic impacts on our economy and society that is caused as a result of opiate and heroin epidemics. Families and communities are being broken apart while millions of dollars are being spent to try and fix this epidemic at its core. Whether it be through the tax dollars we pay for public and social services or the cost of health care, this epidemic has trickled down to affect everyone. WBGU-TV is committed to bringing you the issues that affect us here in Ohio. It is our responsibility to bring awareness to this epidemic. We now present Part 3 of our series, The Social and Economic Tsunami. Addiction to prescription opiates and the path that has led many to heroin has resulted in many ramifications for our communities and our economy. The sectors of society that have been impacted the most have been broken down into 4 areas: medical, labor, crime, and social services. It's imperative to look at these areas as we search for answers to this epidemic.
The opiate epidemic that we're facing is insidious. There are 2 things that we don't see. One is the larger impact on every family in our community, and 2 is the impact that it will have on every single family in our community. When you have a law enforcement, our courts, social welfare, and every system in our community right now focused on this opiate epidemic, and the impact on the line, it could be devastating.
In terms of economics and what is the cost of an individual's addiction on society, an individual who may or may not be related to you, there are several cost factors. So we can look at hospitalization. The cost for hospitalization can go up, the cost for insurance, the cost for medication, as well as the cost for incarceration. And our taxes directly go to each of those costs.
It's kind of like throwing a pebble into water where you start to see the rings go out and out and out. Depending on the level of severity and the level of involvement, that impact in the water can be bigger and bigger and bigger. And you multiply that by the thousands of people that are impacted directly as the user, and then think about all the people surrounding them that are trying to help and the kind of impact that it's having on them.
If you look at local and state taxes, I mean, we're paying for individuals who are in the prisons and the jails. We're paying for emergency service runs for folks who are overdosing. I've had a county commissioner tell me that, 70 to 80% of all their local costs are because of addiction, because of what they're paying for the local courts, what they're paying the local sheriffs, what they're paying for their jail system, what they're paying for kids in out-of-home placement. This is driving cost across the country.
From our society standpoint, kids are at a loss. These are parents. These are their loved ones that are affected by this awful drug. So we're looking at just a large, significant impact from our community standpoint on so many levels that it's really hard to define. For so many people, they think that this is poverty, that this affects just those that are living in poverty. And the reality is it is affecting everyone.
From emergency medical runs to special treatment facilities, the cost to treat the illness of opiate and heroin addiction is enormous. The price of hospitalization, rising insurance rates, and medication-assisted treatment are just a few of the medical costs in which we all bear the burden in one way or another.
When you look at the economic impact of what's happened in Ohio, and I can just only speak to our community, we've seen a massive increase in medical runs. people ODing. I mean, there's 5 or 6 ODs a week here. That's a cost, the burden on the system.
An overdose cost. It's not just the ambulance coming out. Usually you also have an officer. Most runs, the estimation is about $100 per run, per officer. Then you have to talk about the time it takes for that officer to write up what's called a U-10 or write up the actual report.
The cost of an overdose is pretty extensive. The taxpayer bears the bulk of that burden. We're all highly trained emergency medical technicians as well as firefighters, and we all have a number of other rescue capabilities here that makes us a good value for the taxpayer. But at the same time, when there's a call for an overdose, we have at least 3 and sometimes more if the call requires it. Highly trained rescuers respond.
Heroin? Get some heroin? Okay. How often do you use?
It's a pretty big expense. It's $550 or $600 per call, depending on how much care that we provide. And understand that the revenue from that doesn't begin to offset the expenses that we incur here at the Fire Division for our emergency medical service. That's all subsidized by the taxpayer.
It was estimated that unintentional overdoses cost hospitals $7.7 billion in the state of Ohio. Those costs go on and on. Then you have the recovery cost, right? What happens afterwards.
An inpatient treatment, at least in the state of Ohio, can run anywhere from $800 to $1,300 a day. And that includes their detox, because most go in with significant high and they're unable to stay clean, so they need to go through that detox and have their withdrawal symptoms controlled and managed before they can actually engage in the official treatment. I would say on the average, most patients are there 30 days. You have to take in a lot of consideration of the individual and where their needs are. Some patients are going to need Suboxone as the method of treatment for their addiction. So with Suboxone, the cost can vary, but the average for a month for them to be on Suboxone is roughly $300 to $400. When you look at Vivitrol, it's a new medication that actually was just approved in 2012 for Medicaid to cover for addiction treatment for opiate addiction. I would say on average it's probably $1,000 per month. Research indicates 18 to 24 months is recommended. So if you're looking at $1,000 for 18 to 24 months, we're looking at least the $24,000 to take care of most of these individuals.
As you begin to add up the figures, it becomes a significant amount of money that over time decreases as the person gains more control and is further along in their recovery.
As the medical costs to treat each addicted individual continue to soar, the productivity and strength of our labor force decreases due to a lack of available workers. If people are sick, unable to work, or simply not motivated due to their addiction, their effectiveness as a contributor to the labor force is either limited or non-existent.
A business, a workplace, that is the backbone of our economy in this nation. If that's compromised or hobbled, then it affects every single citizen.
We experience in our area, and actually across the state, the Ohio Chamber of Commerce has even adopted this, is that there are more jobs in Ohio, there are more jobs in our area than there are people to take those jobs. But there's another piece to that I don't think we think about, and that is if your wife or your husband is addicted to opiates, that impacts you. That impacts you at work. Your mind is half there, you're half worried, you even become ill from stress, or you're working and you're worried about your son or your daughter or a friend who has an opiate addiction.
Right now, more than any time in history, people are failing drug tests and are using drugs while on the job. And that is one of the most expensive propositions for somebody to use it on a job and have an accident or an injury.
Problems and cries we hear across the state and across the nation is, I can't find a labor force that can pass a drug test. The biggest stay awake at night type of business factor is workers' comp, the cost of insurance, production, productivity. And when they say lost productivity, we're talking about no shows at work, poor workmanship, have to redo, have to, farm out, have to replace, the cost of replacement, of employees. So that productivity factor is huge. The employers are paying $81 billion of that freight, and $42 billion of that is in lost productivity.
If we take a person who is working, who is employed, who has an injury on the job, that injury results in a filing with the Bureau of Workmen's Comp, which is a state office where your taxes absolutely go to. And then that person goes to get treatment. And during the treatment, the person is prescribed opiates. The person can start to abuse the opiates, become addicted. And then when the Bureau of Workmen's Comp says, you know what, based upon what our standards of treatment are and the methodology for recovery, you're going far beyond what the normal prognosis or diagnosis or recovery time is. And so based upon test results, so on and so forth, we're no longer going to provide you with this. You're able to go back to work. If you are drug seeking and you're employed and you're using while you're employed, you're putting the business at risk. What if it's a small business? We're looking at treatment and insurance costs going up.
It's like we know that 1 out of 5 people in just the United States are misusing the drugs. That costs $25 billion. It's like, where do you think that money is coming from? Who is paying for that? That's going to come back to us in the cost of drugs and medicine and health care. It's going to come back to us in the cost of all the supplies, vendors, and support that we need to run a business. And that's the kind of thing that we're facing right now. And that cost of doing business plays out in every way for that business. They are going to pass that on to the consumer.
As economic stability in an individual suffers, the natural progression of addiction results in crime and other drastic measures to obtain the fix. Theft, burglary, and the selling of stolen goods usually feeds the addiction. The result of these actions have led many to incarceration.
In the city of Bowling Green, we started to recognize that there was an issue in about 2013. It really exploded for us. Before, in 2010, we had one case, possession of an opiate. We had one trafficking. That exploded to 12 trafficking incidents, 8 possession arrests in 2013, and we started seeing people dying from this epidemic. We recognized pretty early on that retail thefts had an addiction component. We started seeing a lot of push-outs at your big box stores like Walmart and Meijer. People were going in, filling up carts, pushing them out and getting them in, and they were trading this stuff for drugs. That money has to be made up. That's a loss for the company. So that money has to be made up, and they do that by raising prices. We catch those people, we put them in jail, then we have that cost as well. They have to be housed, have to be fed and cared for, and they have to receive treatment for their addiction while they're locked up. Those are tax dollars again that are used to combat this problem.
As we look at the cost of incarceration in this state, it's cost us $25,000 to house a person for a year. If a person would stay for 4 years, $100,000. So that is a huge investment on the part of the taxpayers, quite frankly, that are I think all feel overtaxed to begin with.
In 2012, there were 7 million individuals involved in the criminal justice system. That individual isn't paying for that cost in jail. You're paying for that cost in jail out of your taxes, usually on the county side, or the city covers those costs of jail nights. So you're absolutely paying for the cost. You just may not be able to break down what dollar goes towards what fund, but your dollars directly go towards the cost of addiction.
You look at the number of individuals in the correctional system or in the local jail system who have an addiction. Some people will tell you it's as high as 80% of the folks. What we know is folks with a significant addiction, if they don't get help, they tend to cycle in and cycle out of local jails. They tend to cycle in and out of prisons, which is why we are so intent on trying to get people the services they need. We want to see to it that they got help and that we get them connected with local treatment systems so that they'll stay out of jails and prisons. The societal cost of addiction, particularly opiate addiction, is huge.
I don't care if they've been in prison 1, 2, 3, or 4 years. If we've not addressed the addiction issue, addiction still exists, and they have a much higher likelihood of committing more crime once they're released, creating more crime victims as we have.
With an addiction that has a track record of breaking families apart and crippling communities, social services and programs play a vital role in helping our society heal from the wounds this addiction creates. From treatment, welfare, child protection services, and more, the cost of social services are rising at alarming rates.
If you look at the impact addiction has on other health and human services, we know that many of the children who are in out-of-home placement, again, some say as high as 80% of those kids, have one parent or another who is, at the very least, has a substance use disorder, if not an addiction. If you look at the number of clients that are involved with the prison system, if you look at the kids that are in the Department of Youth Services, addiction and mental illness are big drivers of cost.
So whether I'm talking about a young person who's addicted or a parent who's addicted, there are social services costs all along the way. So if a parent becomes addicted and as a result of their addiction becomes negligent, a social service impact is the child may be removed from the home. That child is then placed through Job and Family Services or Children's Services, and that has a significant cost depending on the level of placement.
Certainly, child welfare services is expensive. It costs taxpayers dollars, it costs you and I dollars. In Ohio, we spend approximately $1 billion in children's services, and that's a lot of money. The cost associated with our system is when children are placed in out-of-home care. So the more children that we place in out-of-home care, the more cost there is to Ohio's taxpayers. We have seen the numbers increase steadily over the last couple of years, in part due to opiate addictions. And these families require intensive case management.
Social service isn't just about prescribing a pill. It isn't just about saying, well, you just need to do talk therapy. We have to treat the entire individual, the individual's family, and to make sure that there are no gaps in services. So you're talking about everything from where they're going to live, who's going to pay for that, where they're going to receive treatment, where are the children going to receive counseling, where's the person going to receive workforce development so that they can get back into the workforce, who's going to pay for the cost of insurance, who's going to pay for the cost of health care. Those are all costs that are associated, but they're also behavioral or integrated health care.
Our families, they need a lot. Child welfare is just one part of the safety net for our community. And we can't do it alone. We can't be the only agency that are keeping children safe and we're not. There are many agencies working together to support healthy families. It's critical that we work together collaboratively. Otherwise, we will see more tragedies, we will see more abuse, we will see more neglect of our children in Ohio.
As we continue to examine the cost to our economy and society, numbers do not lie. The cost of opiate addiction is staggering, and it's affecting us all. Where we go from here will depend on how we educate and prevent current and future generations from making the same mistakes.
Unfortunately, can only look at this through my lens, and that is just in a very small rural community, the impact that this has had on our residents and our fellow community members. And I look at the devastation that it has had across the board in many aspects of people's lives, and I see the immediacy.
As a nation, we really need to have a sense of urgency in battling this epidemic and making sure that we put it in check and that we remember to go back to the beginning, do good education, do prevention, and make sure we have the systems to intervene and to treat. We can't afford the cost that this epidemic is burdening us with. If we're spending our dollars because we are reinforcing and helping and not preventing illness, then we are losing valuable dollars that could be spent in education, in gearing up, in training, and really enhancing our workforce.
We've got to treat this like the chronic illness that it is. We can't say that this is just a social problem. We can't say that it's a character weakness or a moral failing. It is an illness, and we've got to treat it like the chronic illness that it is. So the reality is we have to instill in people that it'll be a hard road, but once you get on the other side of treatment and once you get into recovery, life will be better. And I can say that personally, life is better when you're in recovery.
Everyone has to take part in this. Families, friends, law enforcement, rescuers like the fire department, EMS, teachers, social workers. I mean, it's a societal problem, it's a systemic problem, and everybody really needs to participate in that.
We'll look back on this like we look back on polio, or look back on some other terrible disease, or it must have been the way my father looked back on World War II. You know, it was a terrible time. I'm glad we're through that, and we've moved on to a different era. That's my vision. My vision is that we can take back our communities, take back our children, and we can get people well because we know how to do it. It's just a matter of everybody stepping up and doing their part.
We often are trying to quantify it so that it's much more palatable for people, or so that they understand it. This issue of opioid addiction, abuse, and death is costing this nation close to $100 billion to $120 billion. But instead of going with dollars, I really want us to look at life, not just life expectancy, but the lives of the children of these parents who are overdosing, the lives of the parents who are watching their children die slowly. Instead of looking at the number of dollars spent, we really need to focus on the number of lives that are lost and make a commitment that not mine. Not to be naive and say, well, that's not happening in my home or that's not happening in my community. Assume that it is happening. And as a result, what kind of person am I? What kind of community member, what kind of parent am I if I don't admit to it and have an honest conversation about it?
I would like to thank you for joining us for part 3 of our series. The social and economic impact on our society is only part of the problem. The real problems are the lives that are lost every day to this epidemic. Ohio is averaging 5 deaths every single day, and it's up to us to fix this. It may not be your family directly, but someone you know is suffering and is at risk. This epidemic is a serious issue for a lot of families, and we're here to help shed light on this dark subject and bring awareness to the issue. For WBGU TV, I'm Steve Kendall. We'll see you next time. If you or someone you know is dealing with an addiction, please call one of the numbers on your screen to get help. Recovery is only one call away. You can also log on to the State of Ohio's Start Talking website to get more information and assistance.